Hello, welcome to another TDOC Talk. Today we are at the Jackson DRC to talk about a new pilot we're launching in community supervision, District 61. Tonight's guests are Forensic Social Worker Supervisor Rachel Tapp and District Director Nancy Richardson. Ladies, welcome and thank you for being here. Supervisor Tapp, could you tell us how this pilot works?
What's going on is this is for the probation parole officers to submit their referrals to the forensic social workers through Vantage. The current system is for them to send us paper referrals via email, sometimes in our mailboxes in the offices. And this is one of the main goals is to streamline our referral process. And also to increase communication and collaboration between the officers and the FSWs by placing the referrals in Vantage where there's access to the risk needs assessments and the offender case plan.
Okay, is Vantage a software that we're going to be using?
Yes, that's the software where the FSW workflow will be. And the officers will go into a particular individual's case and they will submit a referral to the forensic social worker through that software.
Okay. Director Richardson, could you tell me how this might help our probation parole officers in their jobs?
We believe that this will streamline the process. Right now, our officers are doing paper referrals to the social workers, and we believe by being able to go through Vantage, then it will streamline the process so that they can do the referral. The social worker will have it available to them immediately, and therefore be of better benefit to the offender.
Supervisor, could you tell us why this pilot is important?
Again, it's important to increase the communication and collaboration between the officers and the FSWs, but also it builds in some checks and balances and makes the data more readily accessible for people to look and see how many individuals are being referred to the forensic social worker, what kind of services they're accessing, and I think it will, in the long run, be a lot more convenient for the officers.
For those of us who aren't aware, could you explain to us what a forensic social worker is and what you guys do?
There is a forensic social worker in every county, in every community supervision office across the state, and day reporting center. We complete an in-depth biopsychosocial assessment with every client. We accept referrals based on substance use and mental health, and we make a service care plan for them and share those recommendations with the officer. We work with grants to get them into residential substance use treatment or intensive outpatient substance use treatment. We work with community health centers to utilize the safety net grant to assist people getting their medication and needed behavioral health services, and we work with the day reporting centers and community resource centers.
Director, could you tell me the benefits of this new pilot?
Well, of course, we believe that once the offenders are released into the community, then it's part of our responsibility to assist them in becoming productive members of that community. And many times they have issues that require the assistance of the forensic social workers, whether it be mental health, alcohol and drug issues, or any other issues that are hindering them in that process. And so we believe that, as I said earlier, with being able to streamline the process, that we can address those issues in a more timely manner and assist that offender as they progress in the community.
When this software was developed, it was along with a team of forensic social workers across the state, the community, the rehabilitative services CAs, and Vantage. And when we sat down with them, they asked us, what do you think would help? What kind of workflow would you like to see? And this is the first part of what they came up with. We plan to pilot it in District 61 for about 30 days. After that, look at the data, see if things need to be changed, and then it will be implemented statewide. There is a team that is working on a plan for training the officers and FSWs across the state.
Director, since this is piloting N61, could you tell us some of the feedback from your officers?
Yes, our officers are very positive. We are pleased that 61 was chosen for this pilot project. We're in the training phase. We expect that as we answer all the questions and go through this process, that it's going to work very well for our officers, and they are excited to do this.
Throughout this interview, we've been showing clips of what the officers are doing in the training. Could you guys explain to us what they're going through?
Yes, our officers they brought their computers today. They each brought an example for a referral so that they can do some hands-on training at the end of the training, so that when they leave here today, they'll know exactly how the process works.
In addition to the officers, the 3 FSWs who cover counties in District 61 are in the room, along with the correctional counselors assigned to the West, and they're working with the Vantage team to test the software in actual cases. They're working on receiving referrals in their counties that the officers have brought. So they're not test referrals, they're doing real referrals today.
Awesome, great. Well, thank you guys for being here. We really appreciate it.
Thank you for having us.
Tune in on September 5th for the next TDOC Talks. And as always, follow us on social media, Instagram, Facebook, Twitter, and YouTube. And check out our website, tn.gov/correction.